Hello, I'm Dr. Todd Greetens. I'm a pulmonary and sleep physician, and today's presentation is regarding the benefits of sleep, what is sleep, and some means to achieve better sleep. Sleep is something that involves about a third of our life, and people are always wondering, do I need sleep? People think that if they don't sleep, they can accomplish all these things that they would do with that extra time. Sleep has very much physiologic importance to our body. Every mammal sleeps, insects sleep, all living creatures sleep. There's been adaptive developments so that some animals like whales and dolphins sleep one side of their brain at a time. It would definitely be beneficial if we didn't need to sleep. We could be that much more productive. Animals out in the wilderness wouldn't be vulnerable to predators when they're sleeping. They could forage more and eat more food. There would be a survival advantage if we didn't need to sleep. However, all living beings sleep, and it's necessary. Sleep is something that our society doesn't value and leads to issues with our health and our psyche and our mental stability, and it needs to be reconsidered. Sleep can benefit you. I'm Dr. Greetens, as I introduced myself before. Sleep is an essential function that allows your body and mind to recharge, leaving you refreshed and alert. Healthy sleep also allows the body to stave off diseases. Some of the problems with poor sleep or insufficient sleep is that sleep affects increased risk of heart disease. When a person doesn't sleep enough, there's increased cortisol or steroid levels, which then lead to increased weight and insulin resistance, which can result in diabetes. This can increase hypertension or high blood pressure risk. It certainly affects the brain. There's concentration issues, depression. There's even data that shows that if you don't have enough sleep, your pain threshold is different, and people are more susceptible to pain with insufficient or poor sleep. The brain doesn't function as well, and this can impair your abilities to concentrate and think clearly. It affects the ability to process memories. Another factor is it affects alertness and can increase your risk of having an accident or trauma, which certainly can affect your health. There's even thoughts that sleep is one of the effects of ADHD. Patients with ADHD have very short attention spans. They're very jittery. Children who are sleep deprived oftentimes have ADD or ADHD features because they're fidgeting to stay awake. They don't think of or they don't hear what the teacher is saying because they're partially inattentive because they're fidgeting to stay awake, and also their memory and their ability to listen to the teacher is affected by being tired. So children are very much affected, but I think this carries over into adults too. Our memory and our ability to process is affected if we're tired or sleepy. Again, it has a risk for type 2 diabetes by insulin resistance. It causes weight gain. Certainly your accuracy of memory is affected. In car stimulators, it shows that your reaction times to reacting to something on the screen and applying the brakes is affected. It even affects like growth in children. It increased risks of obesity. Now, what is enough sleep? Most adults need somewhere between 7 to 9 hours of sleep. They've done studies that show that people who sleep less than 6 hours have increased mortality compared to people who sleep 6 hours or more, so your risk of death is higher if you get less than 6 hours of sleep. There are many people who think that they need less than 6 hours of sleep and they function fine, but if you actually study them, they're very sleepy and they're just in denial. Children and teenagers need more sleep than typical adults. Children younger than 5 need even more sleep. This is a table that shows that sleep need starts out really high with newborns needing 14 to 17 hours of sleep. By the time children are in preschool, it's dropped down to 10 to 13 hours. School-age children from 6 to 13 need 9 to 11 hours. Teenagers need 8 to 10 hours. And that's one of our biggest areas where we do poor. Teenagers rarely ever get 8 to 10 hours of sleep. Many of them are sleep deprived because of work and school schedules, social media, cell phones interrupting them during the sleep. Once you're an adult, it's 7 to 9 hours. Older adults may decrease to 7 to 8 hours, but you can see that sleep tends to be about 7 to 8 hours for adults, and I would suspect that most everybody is not getting that. Myself included, I have to make a point of trying to protect my schedule to get enough sleep. Work schedules, day-to-day stressors can be disruptive to sleep. If you're thinking about something, that can lead to insomnia. The bedroom environment can be a factor with TVs and cell phones and reading in bed on your phone before you go to bed. All of those can affect sleep. We're going to talk about the different stages of sleep. So what is sleep? Sleep has 3 stages. There's actually 2 types of sleep. There's non-REM sleep, NREM, which is non-REM sleep. REM is described as rapid eye movement sleep, and REM sleep is generally the dream sleep. We actually can dream in non-REM sleep, but they're not very vivid, they're not memorable compared to REM sleep. So everybody considers REM sleep the primary dream sleep. During non-REM sleep, or stage 1, N1, is just a transitional sleep. It's it's the starting of sleep. N1 sleep is interesting in that when a person's in N1 sleep, their eyes are closed, they may even be starting to snore, their breathing pattern has changed, but yet their brain is awake, and if their partner talks to them and wakes them up out of N1 sleep, they don't feel they were asleep, but yet their partner saw that they were asleep. Stage 1 sleep generally lasts a few minutes, and I'll show you a breakdown of what sleep looks like on a later slide. Stage 2 sleep is from a person transitions from stage 1 to stage 2 sleep. During this, you become more relaxed, your heart rate slows down, your breathing slows down, your muscles are more relaxed, your eye movements slow down. People, when they're transitioning to sleep, have slow rolling eye movements that resolve. That's different than the rapid eye movements that you see when a person's awake, or the rapid eye movements that a person has when they're dreaming. Your body temperature also starts to decrease as you transition into stage 2 and deeper sleep. There's different brainwave activity that we can measure when we do a sleep study to determine these stages of sleep. Stage 2 sleep is actually, or N2 stage 2 sleep is actually the longest of our 4 sleep cycles, and it is actually important sleep, but it's different than the deep sleep and the REM sleep. N3, or deep sleep, stage 3 sleep, is the most important sleep there is. Everybody thinks dream sleep is what refreshes us, but it's actually N3, or deep sleep. They used to call it slow wave sleep. During this type of sleep, our brain waves are very slow, they're high amplitude, the body is most relaxed, and this is where growth hormone is secreted. This is where your body recovers from the day. If a person is sleep deprived, this is the sleep that shows up first and most prevalent. A person will only achieve dream sleep once they start to refresh the N3 sleep, or the deep sleep. So this is the healing sleep, this is the restorative sleep, unlike REM sleep, which is different, which I'll get to next. REM sleep occurs later in the night. It doesn't occur until after about 90 minutes, because your body will go through N1, N2, and then deep sleep well before REM sleep. REM sleep is the most similar to being awake. Your eyes are moving just like they are during wakefulness, except that your body is asleep. Your body is paralyzed during REM sleep so that we don't enact our dreams. REM sleep is like a movie running in your brain where you're seeing, hearing things, you're reacting to things, and your cerebral cortex is actually firing the nerves to move the muscles to do what you're doing in your dream sleep. There are some people where they lose that paralysis that's natural during dream sleep, and that's a medical condition called REM behavioral disorder. We've always, anybody has a dog or had a dog sees when their dog is dreaming, they see it makes little yelping noises and its legs twitch. Dogs seem to have a little bit of breakthrough during their dream sleep, and we see them doing that. So dream sleep is more like being awake than it is like being asleep. We don't know why dream sleep really occurs. There's various speculation. People speculate that it's for consolidating memory, that it might be for creativity. It's one of those questions we don't really know. They've shown that if you deprive a person of dream sleep, not much really seems to happen to them, although there's some effects with the psychiatric conditions. Early studies showed that reducing dream sleep temporarily improved depression, although it wouldn't be a treatment for depression. If you deprive a person of deep, slow-wave sleep, on the other hand, they definitely are more tired, they're definitely more symptomatic, and there's definitely a difference between N3 deep sleep and REM sleep. The duration of each sleep cycle changes as the night goes on. There's something called the ultradian rhythm, and I have a slide showing that, which I will go on to next. Now, one thing that happens is as people get older, we have less slow wave or N3 deep sleep. We also have less REM sleep, and we have more N3 sleep N2 transitional sleep as well. So as we get older, we have more N2 sleep, we have more awakenings, we have more N1 sleep, and unfortunately we lose some of the N3 and REM sleep. Drugs and medications can affect these as well. These 4 stages of sleep, it should be 3 stages. In the old days, they had a stage 3 and stage 4, which are now all considered N3 or deep sleep. So these 3 stages of sleep repeat cyclically throughout the night until you wake up. For most people, the cycle is about 90 to 120 minutes. This sometimes presents itself as people who wake up every 1.5 to 2 hours will have REM sleep occur. Sleep apnea is most prevalent during REM sleep. That's where it usually shows up first, and so awakening and having trouble every 1.5 to 2 hours can be one of the signs of sleep apnea, which I'll get to shortly. Non-REM sleep constitutes about 75 to 80% of each sleep cycle. Most people between the cycles will have a brief awakening, rollover, reposition, and will then transition right back to sleep. Many people don't remember this, but many people who've had sleep issues will have more of an arousal and remember this. It's natural to wake up about every 90 to 120 minutes, briefly reposition, fall back asleep. If a person cannot fall back asleep, that becomes a sleep maintenance insomnia issue, which is something we could address at a later talk. The cycle of going through sleep stages is called the ultradian rhythm, as opposed to the circadian rhythm, which is a daily rhythm. This is a 24-hour rhythm that cycles through sleep. This is what stages of sleep looks like, and what a person can see is that they start out awake, there's a brief N1, brief N2, and then the body has the slow wave, the N3 sleep, the restorative sleep, and you can see as the night goes on, that gets paid off and it gets less and less. You can see that there's a brief REM period at the end of the first cycle, and then the person transitions back and starts the cycle over, and you can see that as the REM sleep, as the night goes on, you have more and more dream sleep and less of the deep sleep. So the body always tries to pay off the deep sleep, the restorative sleep first. And you can see that as you get towards the second half of the night, it's mostly REM, dream sleep, and the N2 sleep. Sleep has other effects on the body too. There's benefit for your immune system. People who are sleeping well will have a better immune system. They've shown that healthy sleep can protect you. When a person is sick, we sleep more, and that's probably part of the healing process to allow our immune system to defend us when we're sick. Sleep increases your immune system function, but it's also shown to improve your response to vaccinations. So if you're going to receive a vaccine, if you're sleeping better, you'll probably have a better response to the vaccine. This is something that should be kept in mind, for all of us as we look at that when we're, as parents, vaccinating our children. Our children are less susceptible to getting sick if they're getting enough sleep, and the vaccines are more effective if they're getting better sleep when they're vaccinated. So what recommendations are to try and improve your total sleep time. If you only allow yourself 6 hours in bed, you're only going to sleep less than 6 hours because there's transitional time. So the National Sleep Foundation recommends 9 to 11 hours of sleep for school-age children, 8 to 10 hours for teenagers. That's a problem because teenagers have some of the busiest schedules. 7 to 9 hours for adults, and 7 to 8 hours for adults over 65. So some of the recommendations to try and achieve this is you actually have to have a schedule. You have to have a set wake-up time, a set bedtime, and you have to try and adhere to it. Certainly things come up in life that affect that, important phone calls, but a person really needs to kind of set what their schedule is, let your family and friends know what your schedule is so that you can be undisturbed when you need to sleep. Sometimes this isn't practical with jobs and shift work, but if you are able to try and have a set schedule, no matter what your sleep schedule has to be. A relaxing bedtime routine can be helpful, calming music, reading a book. Exercise is important, which I'll get to. Taking a warm bath can help. You also want to set a routine with a friendly bedroom. You want a quiet, dark room. You really need to shut off electronic media, including your phones and TVs, an hour before bed. You like to have a cool, dark sleep room, a cool, dark room to sleep in. A room that's hot or noisy certainly disrupts sleep. Having TVs on during sleep, people think that helps them sleep better, but trying to transition away from that because the bright lights, the flashing of the TV actually disturbs sleep. They've done studies that show that people who use electronic media right up till bedtime have an hour and a half less sleep than a person who is shutting off the electronic media. The sleep is fragmented with frequent brief arousals when you use electronic media right up until bed. They did that study and took people who were using electronic media right up until bed. They had them stop it, and they actually picked up that hour and a half of sleep. I can't emphasize how much this affects your sleep. Exercising regularly helps improve sleep. This doesn't have to be vigorous aerobic exercise. A low-impact fitness program like walking, swimming, yoga, exercise bands, and is also helpful. It doesn't have to be real vigorous. It can be done in your home. Make sleep a priority of your life, and you'll sleep better, and you'll protect yourself, and your health will be better. A good night's sleep starts how you do your routine. Eating and drinking affects sleep. You want to try and avoid eating within 2 to 3 hours before bed. If you drink caffeine, you want to try and stop the caffeine after the noon hour or early afternoon. The half-life of caffeine is 5 hours. So that means if you have coffee at 5 p.m. or a Mountain Dew at 5 p.m., half of it's still there at 10 p.m., and a quarter of it is still there at 3 a.m. So caffeine, a standard half-life is considered to be 5 hours. As we get older, the half-life might be longer. Nicotine also affects sleep, so people who are using tobacco products or nicotine products, those certainly affect sleep. See, a person definitely wants to limit their caffeine in the, I would say, early afternoon and onward. Certainly want to limit nicotine for many reasons, including the health risks from nicotine, which should be definitely avoided. You want to create a nice environment conducive to sleep. Sounds like soft music before you go to bed can relax you. Some people find scents and fragrances like lavender can help a person feel more relaxed. Certainly the routine can help you develop a pattern. Sleep is one of those things that the better you do, the better you do. If you're doing poor, a person thinks about that they're going to do poor, and it becomes a self-fulfilling thing. You want to remove your televisions, tablets, phones. If you have to use it, you want to try and decrease their brightness setting. There are some night modes that reduce the amount of blue light. Studies have shown that this might help, but it's not as good as avoiding it, in that even in night mode, it can interfere with the quality of your sleep. You want to invest in a comfortable bed. There really haven't been studies that show one bed is better than another, but you certainly want to have a comfortable place to sleep. That can be different for everybody. Some people like firm, some people like softer, but you want to have a mattress that supports your spine. You want to have comfortable pillows. Finally, you want to eliminate noise sources. You want to have the TV off. If you have outside noise like road noise, a soft white noise machine like a fan or a white noise machine can be helpful. That way you're less likely to be startled by an unexpected sound. When a person has sleep, other medical conditions, this can certainly affect sleep. I just have two of the more common problems. There's multiple common other problems that can affect sleep. There's medical conditions that can affect sleep. Sleep apnea is by far one of the most prevalent ones. Sleep apnea could be a talk all by itself. What is sleep apnea? Sleep apnea is when a person falls asleep, their muscles relax. Part of the relaxed nature of the muscles is snoring. What happens is they relax even deeper, and their airway starts to partially or completely obstruct. It's called obstructive sleep apnea. When it partially or completely obstructs, a person is starting to choke. Oftentimes a partner will witness this, that the person is snoring, they stop breathing. This is pretty common. It can happen in children, teenagers, or adults. In children, it's more common when they have large tonsils. Weight certainly plays a role for all patients with sleep apnea, but we see skinny people with snoring and sleep apnea as well. Sleep apnea leads to non-restorative sleep, where a person feels tired when they wake up despite sleeping all night. Many people with sleep apnea feel that their sleep is great. They aren't aware of what's happening. Their partner is aware, maybe, but the patient themselves isn't. Some partners aren't aware, though, because if your partner is a sound sleeper, they won't be aware of what you're doing. Urinary frequency is actually one of the symptoms of poor sleep. When a person sleeps deep, their kidneys slow down, their bladder doesn't fill as fast, and a person will wake up less to use the bathroom. Sleep apnea and treating sleep apnea oftentimes is a problem. If you treat the sleep apnea, the urinary frequency improves. Dry mouth in the morning from having your mouth open and snoring can be one of the hints that there's sleep apnea. Frequent awakenings can be a hint that there's sleep apnea. The REM cycle, where a person has an arousal or awakening, if that awakening, they awaken gasping, startled, that can lead to difficulty transitioning from REM back to starting the next part of the ultradian cycle. Morning headaches can be part of sleep apnea. The oxygen levels go up and down. That can contribute to headaches. The frequent awakenings increase cortisol or steroid levels, which then increases insulin resistance, so blood pressure and blood sugars can be higher in the morning. Treating sleep apnea can improve to better quality, more sustained sleep, and can also improve sleep. Oops. There's a screening tool for sleep apnea. It's the Stop Bang. I won't spend a lot of time on it, but it's eight bullet points to make you think about sleep apnea. If you have 5 or more, you're considered high risk for sleep apnea. S is for snoring, T is for daytime tiredness, O is for observed apneas or pauses from your partner seeing it, P is for high blood pressure, B is for body mass index greater than 28, A is for being 50 or older, although certainly young people can have it and that doesn't exclude it if they're younger. N is for neck size, and for men, a neck size of 17 inches or greater is increased risk. For a woman, 16 inches or greater is a risk, although again we see skinny people with bad sleep apnea. It's less common, but it does exist, so being thin and fit doesn't necessarily rule out sleep apnea. The G is for gender. Being male is an increased risk factor, although women certainly have it. Women start to catch up to men after menopause. The premenopausal hormonal balance is protective for sleep apnea. But then after menopause, it's not uncommon for a woman to start snoring louder and have more sleep apnea and suddenly develop the symptoms as she becomes postmenopausal. This isn't necessarily always a case, though, because we see young girls that can have sleep apnea as well. So if a person has the symptoms, it definitely warrants looking at it. Again, on this Stop Bang, 5 or more is considered high risk for sleep apnea. Moving along, restless limb syndrome is a very common syndrome. It generally gets worse as people get old, or it's more prevalent as people get older. It can get worse as you get older. About 10% of people have restless limb symptoms. Most people who have it recognize it as their legs are uncomfortable when they start to sit down and relax in the evening or at night. You have this urge to move. It's not necessarily a pain, maybe a creepy, crawly sensation. A person moves their extremity and then they feel better. Getting up and walking might help, but then when they sit still again, it starts to come back. These sensations sometimes go away when a person lays down. Sometimes they persist all night and can disturb sleep. Women are at greater risk for restless limb syndrome, although men can have it. It can occur at any age, although older age generally it's more common. These can be severe bouts that cause a person to have difficulty falling asleep and maintaining sleep. There's a family history for some families of restless limb syndrome. Some families have it. If a person has it before age 40, oftentimes other family members have it because there can be a genetic component. Restless leg syndrome often can be caused by other conditions. Some medications can cause restless limb symptoms or bring it on. Antidepressants can bring it on. So if a person develops restless limb symptoms right after starting an antidepressant, you may want to have your provider consider a different antidepressant. Iron deficiency can bring on restless limb symptoms. If a person has sudden onset of restless limb symptoms, you want to make sure that you're not losing blood. You'd want to talk to your doctor to make sure you're up to date on your colonoscopy, because occasionally patients will present with restless limb symptoms because they lost blood from a colon polyp, and colon polyps can be precancerous, so that's certainly something a person doesn't want to miss. Unfortunately, kidney disease is well associated with restless limb syndrome. Patients with renal failure or like dialysis, they oftentimes have severe restless limb symptoms. Nerve damage, such as neuropathy from diabetes can make restless limb symptoms worse. Pregnancy oftentimes will provoke restless limb symptoms. Many women develop restless limb symptoms when they're pregnant, and then it goes away after they deliver. It's very difficult to treat other than with iron during pregnancy because you worry about drugs affecting the fetus or the baby. It's probably felt that the iron levels shift from the mother to the developing baby, and that's part of the factor. So iron supplementation is important during pregnancy for restless limb syndrome. Restless limb syndrome also goes along with rheumatoid arthritis and osteoarthritis. There are foods and drinks that can affect restless limb symptoms. Many people have chocolate make restless limb symptoms worse. Sometimes sweets and processed carbohydrates like cake will bring it on. Certainly nicotine can bring it on. Alcohol can make restless limb symptoms worse. Restless limb syndromes is a factor with Parkinson's disease. Restless limb syndrome is something that's diagnosed by your provider. It doesn't require a sleep study. It's more of a clinical history. There are various medications that can be used for restless limb syndrome. That's something you can discuss with your doctor if you have it. Many people will try warm baths. They'll try resting before they go to bed and like stretching and walking. Exercising, not right before bed, but in the afternoon might help with the restless limb syndrome. So there's non-medical and medical treatment. Medical treatment is reserved unless you reserve for patients who feel it's symptomatic enough that it's interfering with their ability to transition to sleep, to rest comfortably right before they need to go to sleep, and as well as staying asleep. This is my last slide, but one thing we've talked about, alcohol came up a few times. Alcohol makes sleep worse. Alcohol fragments sleep. Many people think that alcohol helps them fall asleep quicker. It may make you more, it's a muscle depressant, it's a relaxant. It certainly might briefly help a person fall asleep quicker, but as it starts to go out of the system, it's been shown in studies that the sleep is more fragmented and that a person actually sleeps worse and has less total sleep if they drink before bedtime. So if a person has their glass of wine, you want to have it with supper well before bedtime. That goes along with the recommendation avoiding eating food before 2 to 3 hours. Certainly, this is a quick summary of sleep. There's a lot more to it. You can certainly discuss this with your sleep, or if you have a medical condition that you think is affecting sleep, working with your doctor and possibly a referral to a sleep doctor is a consideration. Thank you. Have a good day.